Hi, this is Jessica DaMassa with WTF Health. I am here at HIMSS Health 2.0 Europe, and joining me right now I have Javier de Oca. He is the CEO of IOMED, which is a company that is working in the natural language processing, unstructured data arena. So talk to me about what you're doing exactly.
Sure. So basically, as you said, we are using natural language processing to extract the data from medical records. So all that data information, which is hugely important and hugely relevant, we're extracting it from the medical record and structuring it using for that medical ontologies, knowledge that already exists. And then basically creating this structured database, and on top of that, generating predictive analytics tools.
This is so cool, because I mean, for our audience who's watching mostly in the US, so you're doing that in Spanish, and so you're taking doctor's notes, and so your market is primarily here in Spain, and then also in
Latin America as well.
Spanish-speaking
Latin America, exactly.
Very cool. So what kinds of things, like when you're looking at the notes that you're taking in, all of the information that you're taking in, you said you're layering on top of it like APIs that are very targeted. So talk to me about what, like some of those examples of the APIs that are targeted.
Sure. So as you mentioned, we are developing very targeted, very precise APIs that generate a very concrete result. So, for example, predictive algorithm that predicts the risk of a patient of being readmitted in a hospital.
Okay.
Or predictive algorithm predicting which patients in your patient population are candidates for palliative care, for example. So we can take measures beforehand, before all those events happen, actually. So you can see it's very concrete, very precise algorithms that solve very small and targeted and specific problems within the hospital.
And so how are you getting the problem statements that you're solving for? Who is providing you the problem?
We have very extensive networks of contacts in the hospital sector, and we are very active in having chats with them and exchanging opinions and exchanging possibilities, also in the research arena. So basically from all these environments, we're getting these insights about where these problems actually lie and how we can make to solve them.
What have you been most surprised to find out in working in this space?
I would say in the physician reaction itself. We were expecting, because we were warned about this many times, that we would find some resistance from physicians towards this sort of, let's say, artificial intelligence tools. But it was completely opposite. Because we are solving real problems they have in the real life, they are trusting these possibilities, and the possibilities that this actually makes their professional lives better, and the lives of their patient also better. So this reaction actually surprised us a lot. We're finding a very, very warm welcoming from physicians to this sort of, let's say, professional tools.
Well, I mean, it's kind of cool. It's almost like wizardry that you can read all of these notes and then discern, these trends coming out of the data. I think that's really remarkable. So who are you working with? Who's your customer for this product?
So mainly our customers are technology companies and technology consultants. We were studying the possibilities of also selling directly to hospitals, but that is very challenging here in Spain, given the huge amount of market that is covered by the public sector, and also happens in Latin America a lot. So as our starting business model, we have to target private consultant firms and IT companies. They can also profit very much from this sort of tools, because they will be accessing a huge amount of data they cannot see now, and they will be able to generate new services, new products on top of those data. Obviously, always respecting the data privacy and patient privacy.
Yes. So you're based here in Spain, and are you tell me a little bit about IOMED as a company? Are you guys you're a startup company? So where are you at?
We're definitely a startup company. We are around 2 years. We've been around 2 years. We're here based in Barcelona. 3 founders are working full-time in this project, plus also a team of very experienced freelancers that range from doctors to IT guys to software developers, and that are also spread around the world. So we're hiring people from Sweden, Kenya, the United States, the United Kingdom, Spain. So we're really having a multicultural team right from the beginning, which is amazing.
And you guys are you raising money? Are you in what series are you in? Where are you at?
We're in a seed stage at the moment. We are raising our first serious amount of money. At the moment, we're closing already a round of $500,000. We're really happy with this, because it's going to provide us the opportunity to actually grow our team, grow our products and our catalogs, and actually address this big opportunity that we have in this market.
Very cool. And so your plans for scaling are what?
Big. For the coming years, straight-on plans are to jump into Latin America very strongly. That's a huge, a big market. Just from the population point of view, in Spain we are 47 million, but in Latin America we are way over 200 million. So it's great market, in great market opportunity in there. So our growth potential will come from this catalog of products and algorithms that I mentioned before, and our ability to scale up through these technology partners that we were mentioning, and their ability to actually scale this go-to-market strategy very quickly internationally.
Awesome. Javier from IOMED, very nice to speak with you. Thank you so much. This is Jessica DaMassa here at HIMSS and Health 2.0 Europe, covering for WTF Health. Thanks so much.